Well, let's bring in our panel of political commentators now, joined this week by Liberal commentator Susan Smith, Conservative commentator Tim Powers, and NDP commentator Farouk Karim. Good to see you all. Thanks for being here. Look, Susan, let me start with you. And Doug Ford said he's sorry repeatedly today for some of the measures he introduced in Ontario, almost in tears at one point when he talked about the damage to families and businesses from the pandemic. But he's facing attacks from his own science advisors. The hospitals are at the breaking point in Ontario. What's happening in this province?
Yeah, there's a little bit of chaos, I think, behind the scenes politically in this province. But Doug Ford, I guess to give him credit in one area, he said when he made a mistake, he took it back. He reversed himself and took it back. A bit of the Ralph Klein school of politics. If you screw up, say sorry and don't try hard not to do it again. But I do think it's a reflection of the chaos behind the scenes. That clearly was not advice of the Science Advisory Panel. They have been revolting. So he's trying to get a handle on things. It seemed like a knee-jerk measure that wasn't grounded in anything beyond optics, and didn't help people. It just upset people. And where he needs to take the measures, and we're still waiting for the measures to be taken, is to close more non-essential business so that people can stay home and paid sick days.
Yeah, the paid sick days, which he says he needs to piggyback on top of a federal plan that he says isn't working. But Tim, let's face it, none of the political leaders has had to deal with a crisis like this pandemic before, but some seem to be better at it than others. And I guess, why is there such turmoil in Ontario?
I think, look, give him credit, as Susan said, for apologizing today. That's the first step of him trying to rebuild. He's been, our polling at Abacus, other polls show that this has had a pronounced impact on his negative ratings. They're very high. They're higher than they've ever been. I don't know why he's having difficulty right now, because in fairness to Premier Ford, in the early days of the pandemic, he and the other leaders all seem to be working in harmony and making better decisions than they have been in the last few weeks. From what I see and what I read and what I hear, I think there's competing interests that are impacting the Doug Ford's decision-making process, whether that's some of his rural-based cabinet, some of his political team versus his governing team, and then his science team. I think Doug Ford does well when he decides that he's going to take a particular direction, and as opposed to trying to appease a whole bunch of different entities. I think he's got to try and find his mojo. Look, again, the partisan stuff aside, it's not in Canada's interest or Ontario's interest to have the Premier struggling to the degree that he is right now in this crisis.
Let me bring in you, Farouk. There's now this open fight between the Premier and his science table. We touched on that over the provincial response. That has a tendency to undermine public confidence in the direction that a government's taking on behalf of the public safety of its people. What do you see happening here in Ontario?
The first ammunition that our leaders have in a pandemic and a national crisis is trust. It's important that the people follow and trust the decision maker and the decision leaders. And that's where Mr. Ford is in trouble. I'm not against him saying sorry. I think it's better to say sorry than just to be and stay on the same route, right? But more than saying sorry, we need the new action, new measures. And just on the paid sick leave, I think Mr. Ford is a bit victim of his ideology and not being pragmatic on this, because he keeps on saying, yes, I want to do this, but there's already a federal program. We don't want to double the labor on this. But I remember a few months back when there was problems at the border, he didn't hesitate to send Ontario people at the airport. So he didn't mind doubling down there. So on the paid sick leave, it makes sense to make people stay home if they are sick. If people have to choose between their health and putting food on the table, they're going to go and get the food to put the food on the table. That's clear. Yeah. So we need new measures beyond the apology, and we need to face the fact that when you keep on saying that government is the bad and is in the way of public good, well, what it does is people lose confidence, and leadership is elected, especially on the right wing of the spectrum, not trusting government. And when we need government, they're not able to use it appropriately.
Okay, let me switch. The federal government banning international flights from high COVID spread areas, including India. Doug Ford and other premiers have been calling for that for some time now. These flights are carrying some infected travelers. Health Canada says about 1% of arriving passengers are testing positive. Britain and Hong Kong have already banned flights from India. Now the Canadian government following up on that. But we still don't have tests of essential workers crossing the border into Canada, not even rapid tests. Susan, do we have a coherent border plan in this country right now to deal with COVID?
I think you can't have a one-size-fits-all plan, Peter. You have to examine each situation as it arises. So temporary bans on flights from certain countries, I think, is a good idea. It's the right thing. It's based on science and evidence. Perhaps doing better and faster border screening is a way to go. We've got to get that done based on science and evidence. Are the people crossing the border back and forth in trucks or nurses in hospitals, are they bringing COVID back and forth? I presume they're getting tested in some cases at their workplaces. But I think you can't have a one-size-fits-all attitude. You really do have to look at each of the scenarios from a broad scope and make a decision based on evidence for that.
Tim, what's your view on this?
The banning of flights is a good thing. It should have perhaps happened a little earlier, in line with the British and other nations that have done that. So the government will get a little bit of stick around all of that. It should only be temporary, but it needs to happen. I mean, I'll say this with the greatest of self-interest: some of us can't even fly to different parts of this country, or if we do, we're subject to extreme measures, which are right, because of COVID. So we have to take the same approach with the flights. On the land borders, Peter, to your question to Susan, sure, there needs to be a difference, but there needs to be a vigilance and a consistency, because there's equally a data that's coming through saying, people are unfortunately carrying COVID-19 as they come through. So that needs to be tightened. It needs to be tightened, respecting we still need a commercial link, but we need to do better at that as well, too.
All right, let me hear from you on this, Farouk.
Yeah, I think it makes sense if the science is there. But as for previous debate on borders, let's not put too much emphasis on it, because if the virus is already in the country, I mean, there's no point, right? We need to focus on that. Additionally, on the border, let's not keep in mind that there's also political game between federal and provinces in there, and that's underlying the blame from each side. So let's stick to science and make sure we get out of this pandemic.
How so? What's the game you think they're playing on the border?
Because the border is a federal jurisdiction, and when some premiers on the provincial side are in trouble, let's say like Mr. Ford, they like to put it back on the federal level, saying that it's his problem, like he was saying we don't have enough vaccine, which is true, but there's also additional problems on the provincial side that he should focus on.
All right. Look, time is short tonight, but I appreciate your perspectives. Good to talk to you again, and we'll talk to everybody soon. Take care.
Thank you.
Thank you.